Good afternoon. I want to start off by wishing all Canadians a Happy New Year, and once again thanking our incredible frontline healthcare workers across our country for your continued leadership helping Canadians over these last 2 years. Canadians are understandably frustrated to start 2022 in a way that reminds them of 2020, when the COVID-19 pandemic first upended our lives. Millions of children are once again doing school from home. Parents, small business owners, and everyday Canadians are once again being asked to put their lives on hold, to sacrifice their personal liberties, and to deal with more anxiety and uncertainty that is already causing a tremendous strain on the mental health of Canadians and our wellness as a society. Depuis quelques jours, les provinces et les territoires ont pris des mesures importantes pour prévenir la propagation du variant Omicron, qui est très contagieux. Ces mesures visent à protéger notre système de santé et les Canadiens. Governments across the country had little choice but to take these steps because the federal government has not delivered on key tools to help Canadians manage the risks of a pandemic in a population that is now largely fully vaccinated. In fact, the action and inaction by the Trudeau government is normalizing lockdowns and restrictions as the primary tool to fight the latest COVID-19 variant. It didn't have to be this way. Back at the start of the pandemic, the Prime Minister promised to deliver the tools that he said would reduce spread and keep our society and economy open. From his doorstep in the spring of 2020, Justin Trudeau promised Canadians that he would deliver on domestic supplies of PPE because we could not rely on other countries. We needed made-in-Canada supplies of personal protective equipment to keep healthcare and essential workers safe. So why, 2 years later, do we have PPE shortages in schools and insufficient N95 mask supplies 2 years later? Why does the Canadian Association of PPE Manufacturers tell us that the Trudeau government is back to buying most of their supplies from China? Have we not learned anything? From his doorstep, in the early days of the pandemic, the Prime Minister said he had spoken to the provinces and that he would take federal leadership to deliver on the two most important tools we needed to fight COVID and keep life as normal as possible: tests and contact tracing. That was 2 years ago. So why were schools in British Columbia short 11 million rapid tests to start classes after Christmas? Pourquoi c'était impossible pour les Canadiens d'avoir des tests de dépistage rapides, surtout pour qu'ils puissent garder leur plein pour Noël ou le jour de l'an? Pourquoi posséder un test de dépistage rapide était pratiquement une mission impossible en décembre dernier? La réponse est simple. Le gouvernement Trudeau a fait preuve d'un manque de leadership. Être Premier ministre signifie tenir ses promesses faites aux Canadiens. Being Prime Minister is not just about giving pep talks to the nations, as one person described yesterday's press conference. Being Prime Minister is about making sure the country is prepared for future waves of the pandemic, to lead a full-court press of the federal government to give provinces, communities, and Canadians the PPE, the rapid test, the surge healthcare capacity, all of the tools we need to be safe and to maintain our quality of life as much as possible. Justin Trudeau promised these tools in 2020, and we are paying the price in 2022 for his failure to deliver. As I said a few months ago, the Prime Minister is always strong in ambition and always falls short on achievement. And that is why I'm incredibly frustrated to start off this year. Les Canadiens et les Québécois ont déjà fait leur part. Des millions de personnes se sont fait vacciner. Nous sommes l'un des pays les plus vaccinés au monde. Les vaccins sont l'outil le plus important contre la COVID-19. Si le Canada avait tous les outils promis depuis la première vague, la gestion de la pandémie aura été plus facile aujourd'hui. My wife, Rebecca, and I got our boosters this week, and I encourage all Canadians to get vaccinated. If you have questions, ask your doctor. Talk to someone. The vaccines are safe and incredibly effective at minimizing the severity of COVID, including the Omicron variant. As 2022 starts, Canada desperately needs federal leadership to get our lives back. We need to ensure that all of the provinces, all communities, all schools, all workplaces have the tools they need to help manage COVID, to ensure we can return to normal as quickly as possible and keep things there. Widespread lockdowns and restrictions of liberty were a necessary band-aid to protect us before we had the critical tools to fight COVID-19 safely and effectively. We have those tools now in terms of the vaccines, but we are still lagging terribly on other tools like testing and domestic supply of PPE. Therefore, the Conservative opposition will be convening an emergency meeting of the Health Committee to examine critical gaps in our country's ability to effectively manage COVID-19 variants, despite the high vaccination rates we now have as a country. I'm joined today by my special COVID-19 advisor, Dr. Stephen Ellis, who was part of the frontline healthcare efforts fighting COVID-19 in Nova Scotia before his election last fall. Dr. Ellis and MP Luc Berthold have been working closely with our former Shadow Minister of Health, Michelle Rempel-Garner, to examine the critical gaps that continue to exist in the delivery of tools to fight COVID-19 long promised by Justin Trudeau and his government. We will also be forcing the government to act to prevent the looming trucking shortage that Canada is facing and that will lead to even higher prices for fuel, for food, and everyday essentials that Canadians are struggling to pay at the present moment because of the inflation crisis. Our Shadow Minister for Transport, Melissa Lantsman, has already been in contact with the Minister to push for a solution to avoid more skyrocketing prices stemming from shortages. D'autres pays, comme les États-Unis, offrent des accommodements raisonnables pour permettre aux camionneurs non vaccinés de travailler tout en éliminant les risques liés à ce service essentiel. Si on n'agit pas maintenant, on va manquer des milliers de camionneurs au Canada. Mr. Trudeau called a pandemic election hours after launching a vaccine mandate with no previous legal or policy guidance from the Federal Civil Service. It was done to divide people, and it has likely added to vaccine hesitancy rather than lower it. I said at the time that reasonable accommodations could and should be found for a small number of Canadians who may not be vaccinated. Trucking is just one example where this can be done safely and in line with the legal precedent that is now clearly being established across this country. A leader does not divide and conquer, but finds ways to bring people together and achieve great things. As we start 2022, the Conservative opposition will be relentlessly focused on holding this government to account, to push for the tools needed to manage COVID-19, to fight inflation, to fight to make life more affordable for Canadian families and for seniors, and to try and unite this great country. Canada's Conservatives will be the voice for the voiceless, and we will try and ensure that Canada leads once again. Merci beaucoup. Thank you very much.
Glenn McGregor, CTV News. Good morning, Mr. O'Toole. Good afternoon, rather. The Federal Court of Canada has rejected a request for an injunction brought by some Canadian Forces members against the vaccine mandate in the forces. And as a former member, I'm curious about your position on this now. Do you support a vaccine mandate for regular and reservist members, particularly when some of them are now being deployed in Quebec today, for example, to help with the COVID response?
With service above self that we see in the Canadian Armed Forces, there will be a requirement for many and most operators to be vaccinated. This is a critical job that attaches with it the potential risk that you take by serving your country in uniform. So balancing off, making sure that as many people are vaccinated as possible needs to be the priority for the Canadian Armed Forces. Both Dr. Ellis and I are veterans of the Canadian Armed Forces. And actually, Glenn, this issue has been looked at many times in the past because of previous vaccinations that caused higher hesitancy in the Canadian Armed Forces. So my message to the military and the military families right now is simple. Thank you for your service. The vaccines we have are safe and effective. Ask questions to military docs like Dr. Ellis was years ago, and make sure you're part of our fight against COVID-19. And I think everyone in uniform should be vaccinated.
About 1,400 forces members apparently have requested exemptions, and many of them for religious reasons. And do you think there is a legitimate religious reason on which an exemption from a vaccine mandate should be granted? And if so, which religions and what reasons?
As I've said, vaccines are the most important tool that we have to fight COVID-19. We should encourage as many people as possible to get vaccinated. That's been my approach since the start of the pandemic, since the start of us getting vaccines. I've also said there will be a small number that won't be vaccinated. How do we answer their questions, get that hesitancy down, and in some cases have reasonable accommodation to make sure that people don't get pink slips because they're not vaccinated? The trucking example I mentioned today is an example where the United States and other countries have found a reasonable accommodation for a small number that won't be vaccinated, but to be able to have them operate safely. We will be short tens of thousands of truckers if the government doesn't very quickly address this issue. That doesn't mean I don't think the people shouldn't be vaccinated. It means we have to deal with the reality of the fact that there will be a small number unvaccinated. I don't think shaming and causing division is the way to address hesitancy. That's Mr. Trudeau's approach. Our approach is actually getting people back to work, not dividing people on health.
Fraser Needham, APTN National News. As I'm sure you're aware, there's a major COVID outbreak going on in the Bearskin Lake First Nation, Northern Ontario. I just wanted to see if you had a statement about that.
Yes, this is an area, thank you for the question. The Bearskin Lake Nation is one of several that has, over the last number of months, had to deal with outbreaks. And this is an area of direct federal responsibility for both delivery of health care and giving the tools to reduce spread, reduce risks. There are higher instances of hesitancy amongst First Nation communities. Has there been a targeted program from the Trudeau government to address that? No, he has used vaccines to divide Canadians, and he's abdicated his responsibility to deliver to the Bearskin First Nation, to deliver to the Ontario government, to deliver to all governments and communities the rapid tests and the tools needed to also make sure we use all efforts to fight COVID. And our Conservative caucus would be happy to advocate for the First Nation leadership to get a better response.
And one of the major things that they're calling for there has been some money flow, but they just don't have enough people, I think, to do the various jobs in the community. It's a small community, and about 50%, I think, or more are infected with COVID-19. So they have called on the military quite publicly, and I think in another media outlet it was reported today that National Defence hasn't received a formal request, so they don't know anything about this, even though it's been in the media for 3 days now. I'm just wondering if what the government should be doing there, if military should have been deployed quicker, or what this lag is.
This is another area where the Trudeau government has been unacceptably slow and late to the game. In March of 2020, I said we needed a war footing and needed to deploy the military where needed in our healthcare system, especially in areas of federal jurisdiction like First Nation communities. That was mocked, including with some news coverage of it at the time. The military has been a crucial peaking resource to help make sure that our healthcare system doesn't get overstrained. They shouldn't have to beg and plead for deployment of the Canadian Armed Forces. The government and the minister should be on top of this, and I will ask my shadow ministers to make it a priority.
Bonjour, M. O'Toole, Christian Noël de Radio-Canada. Je vais vous poser une question sur votre annonce du jour, mais avant ça, j'aimerais vous parler des fêtards sur le vol de Sunwing, des commentaires de M. Trudeau hier qui les a qualifiés de sans dessin et d'ostrogoth, et de l'enquête qui a été lancée par le ministère des Transports et Transport Canada. Est-ce que vous trouvez que toutes ces actions-là, de la part des politiciens et de Transport Canada, sont justifiées et quel message vous avez envoyé aux gens qui étaient sur le vol de Sunwing?
Merci, Christian. J'étais déçu par les images avec le vol des influenceurs avec Sunwing. C'était inacceptable de voir un avion en pleine pandémie comme une partie comme ça. Tous les Canadiens doivent suivre les règles sanitaires, particulièrement pour les voyages à l'extérieur du Canada. Et c'est important pour le gouvernement d'examiner cette vol, mais aussi on doit encourager le gros bon sens pour tous les Canadiens dans leur domaine de travail, dans leur vie privée et particulièrement pour les voyages. Like many people, I was disappointed to see the images of the Sunwing flight with influencers. At this stage in the pandemic, we shouldn't see a flaunting of public health measures. Everyone has to follow the rules, particularly when they're in a traveling situation that is their choice that they could do safely if they followed the rules. We need common sense to be applied, and the levels of government that may be looking into this incident, air travel needs to be safe both from a health and a passenger safety point of view.
Au début de votre allocution, il y a quelques minutes, vous avez félicité les provinces d'avoir pris les décisions difficiles en temps de COVID. Et plus tard, vous avez blâmé le gouvernement Trudeau pour les confinements, alors que les mesures sanitaires, c'est les provinces qui en sont responsables. Donc, êtes-vous vraiment en train de blâmer le gouvernement Trudeau pour les décisions qui sont prises par les provinces?
Actuellement, Christian, j'ai dit que c'était nécessaire pour les provinces. Ce n'était pas une félicitation pour les mesures strictes comme ça, mais c'est à cause d'une approche lente et insuffisante par le gouvernement de M. Trudeau en ce qui concerne les tests de dépistage rapide, l'équipement médical et toutes les promesses de M. Trudeau il y a 2 ans. C'est possible de gérer la COVID-19 dans une manière sécuritaire et efficace avec un niveau de vaccination très élevé et avec les autres mesures. J'aimerais voir une approche stratégique et sérieuse, mais malheureusement, c'était un manque de leadership de M. Trudeau et c'était nécessaire pour les provinces de prendre leurs décisions.
Mr. O'Toole, Mike Blanchfield, Canadian Press. What's your message to people who do not have a legitimate medical reason to not get vaccinated and who are still not getting vaccinated in light of the fact we're seeing surgeries canceled, cancer treatments canceled, other life-saving health interventions being interrupted, beds that need to be used for that are now being used for COVID-positive patients that likely were not vaccinated. Do you have a particular point of view on what the message is to them from you?
Thanks, Mike. My message is get vaccinated. And if you have questions, have them answered. I'm never going to attack someone if they're worried. But I'll use an example of how serious this is. Just yesterday, one of my MPs was saying over Christmas, 2 members of his extended family got COVID. The older, less in shape person that was vaccinated had virtually no symptoms. The younger, in shape, unvaccinated person was hospitalized and was on oxygen. Make the right decision. And if you're concerned for whatever reason, have those concerns addressed. The more that we can take the temperature down here, the better for getting vaccination levels up. Mr. Trudeau mocks and actually attacks people that are unvaccinated, calling them misogynists and others. That's not going to get more people vaccinated, nor is constant reliance on lockdowns, because people have done their part. They've gotten vaccinated. And now with rapid tests, with masking, with distancing, with smart rules, a population that's largely vaccinated can properly manage COVID-19. We shouldn't be in lockdowns in the fourth wave. So, Mike, let's get more people vaccinated, but let's also use the other tools to get life back to normal.
You've seen Quebec take measures requiring vaccine passports to buy liquor. Internationally, we've seen Emmanuel Macron said this time to piss off the people who won't get vaccinated. Notwithstanding, yesterday we heard the Prime Minister say, healthcare workers want to see that first-time person and they'll welcome you. They're not going to be resentful. Do you think more pressure needs to be brought to bear on people who are not legitimately getting vaccinated, given the scenario and the anecdote you just gave?
I've said I'll always respect the decisions the provinces make on minimizing the spread of COVID-19, whether it's decisions on passports or whatever. But I think the welcoming approach you talked about, that is the way we have to get more people vaccinated. And that is by taking the temperature down, not dividing our population even more on an issue of health. Look, if I thought that was a way to get vaccination levels up, I would have taken that approach during the election. I've actually talked to medical experts to say the more we take the temperature down, we can get a large number of people that are hesitant vaccinated. We can also have reasonable accommodations for some people that may not be vaccinated, particularly in jobs like trucking and others, where it can be accommodated without any medical risk. We have to start having smart management of COVID-19 because this may be with us in a way that can be managed for a while, as opposed to doing the same things we did 2 years ago with a government that hasn't even delivered what he promised 2 years ago. I'm tired of Mr. Trudeau's pep talks. I want to see action. Je vais toujours respecter les décisions par les provinces en ce qui concerne la santé et le bien-être de leurs citoyens. Les décisions comme ça sont difficiles et c'est pourquoi on doit avoir les outils comme les tests de dépistage rapides. Mais selon moi, c'est le temps de gérer la pandémie dans une manière efficace et sécuritaire avec un niveau de vaccination très élevé, avec une approche d'éducation sur l'hésitation pour les vaccins, avec les tests de dépistage rapides et les autres mesures. C'est possible d'avoir une vie normale et sécuritaire sans les confinements, sans un dérangement dans la vie de nos enfants et la santé mentale de nos citoyens.
We'll now move to questions on the phone. As usual, one question, one follow-up. Nous avons été avisés qu'il y avait du temps pour 4 questions au téléphone. Opérateur, première question, s'il vous plaît.
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question est de Hélène Buzetti, les coop de l'information. La parole est à vous.
Oui, bonjour, Monsieur O'Toole. J'aimerais vous entendre sur un tout autre sujet, celui de la compensation offerte là, pour les services à l'enfance autochtones. Le gouvernement nous a annoncé que ce serait 20 milliards de dollars, mais surtout que le minimum offert à tous les enfants et ou leurs parents serait de 40 000 dollars. J'aimerais savoir, est-ce que vous êtes à l'aise avec le niveau de compensation qui est offert?
La réconciliation est une priorité pour moi et pour notre caucus. Et c'était un positif de voir une résolution d'une poursuite entre le gouvernement fédéral et les Premières Nations et les enfants autochtones. C'était une situation inacceptable. Et c'est pourquoi nous sommes en faveur, en général, de la résolution et on doit travailler en étroite collaboration avec les gouvernements des Premières Nations sur les programmes pour les enfants et d'avoir une approche de réconciliation pour les enfants qui étaient blessés par les pensionnats autochtones. Donc, nous sommes en faveur en général et on va voir l'approche du gouvernement sur la résolution pour le futur.
Mais ma question porte spécifiquement sur les montants. Vous avez raison, on ne sait pas encore quels seront les montants maximum, mais on nous a bien dit que le minimum pour tout le monde sera de 40 000 $. Or, on parle dans certains cas, pas juste d'enfants qui ont été placés en famille d'accueil, et parfois même ça peut être juste quelques semaines, mais on parle aussi pour des enfants à qui on n'aurait pas offert en temps opportun des services à l'enfance, par exemple l'accès à un travailleur social. Est-ce que dans votre tête, un minimum de 40 000 $ pour un déni de service, par exemple, est-ce que c'est raisonnable comme montant?
En général, nous sommes en faveur. Le montant n'est pas important pour moi, c'est l'approche de la réconciliation. Et il y a un pas pour les gouvernements des Premières Nations, pour les services pour leurs enfants, et un montant pour les victimes. On doit travailler avec le gouvernement sur l'approche pour les deux, et comme l'opposition, on va poser des questions sur les deux programmes pour les victimes et pour les gouvernements des Premières Nations. Mais en général, c'est très important d'avoir une approche sérieuse en ce qui concerne la réconciliation. To me, there are two parts of the amount of the settlement from what I've seen in the early coverage of it. One part for child services being run by First Nation governments. I've spoken to Chief DeLorme, who's the first government at Cowessess to take on that responsibility. That is something that will be ongoing over decades, and we support that. The other portion will be some settlements for victims, how that is administered in terms of damages on services and support. That's something we can look at more closely. But I think having a serious approach to reconciliation means that we don't have First Nations, particularly advocates for children, having to go to courts or tribunals to move the federal government to act.
Opérateur, prochaine question.
Thank you, merci. La prochaine question est de Mélanie Marquis, La Presse. La parole est à vous.
Merci. Bonjour, M. O'Toole, et bonne année. Je voudrais vous poser une question, revenir sur votre annonce, donc le confinement. Vous n'êtes pas sans savoir qu'aux Pays-Bas, en France, au Royaume-Uni aussi, on a dû resserrer les mesures pour tenter de juguler la contagiosité du variant Omicron. En quoi est-ce que Justin Trudeau, ici au Canada, a erré davantage que les dirigeants de ces pays-là qui ont été submergés par la vague et qui continuent de l'être?
Merci, Mélanie, pour la question et bonne année à vous aussi. Après 2 ans de la pandémie, malheureusement, le gouvernement de M. Trudeau a normalisé les confinements comme l'outil principal dans notre lutte contre la COVID-19. Les autres pays en Europe et aux États-Unis ont utilisé toutes les mesures. Avec notre niveau de vaccination plus haut qu'aux États-Unis, par exemple, c'est possible d'utiliser les autres outils pour gérer la pandémie, particulièrement après 2 ans. Mais malheureusement, on n'a pas des outils dans un niveau suffisant. Et c'est pourquoi aujourd'hui, je viens de dire qu'on va avoir une enquête avec la communauté de la santé ici à Ottawa pour examiner le manque de leadership. Hier, M. Trudeau a eu une annonce sur 140 millions de tests de dépistage rapides. 1 an tard, pas en pleine de la 4e vague de la pandémie. Donc, on a besoin d'une approche plus vite et on doit livrer la marchandise en ce qui concerne les tests de dépistage rapide, l'équipement médical et les médicaments aussi.
Mais en tout respect, M. O'Toole, les tests de dépistage, je comprends qu'on a eu une annonce de 140 millions. Bon, c'est beaucoup, mais Ottawa en avait déjà et c'était les provinces, je pense, notamment au Québec, où on les gardait dans des entrepôts. La normalisation des confinements ne vient-elle pas plutôt des provinces comme le Québec et comme l'Ontario?
Il y a 2 ans, au printemps 2020, M. Trudeau a promis un approvisionnement suffisant des tests de dépistage. Mais malheureusement, c'est impossible de trouver les tests de dépistage rapides en décembre avant les vacances. Hier soir, j'ai utilisé un test de dépistage rapide. C'est un outil crucial pour notre lutte contre la COVID-19. M. Trudeau a dit ça il y a 2 ans, mais il vient d'annoncer un ordre pour les tests de dépistage rapides en pleine de la 4e vague. C'est inacceptable selon moi. C'est pourquoi on va poser des questions sur tous les sujets, incluant l'équipement médical fabriqué chez nous. On doit être plus autosuffisance comme un pays et on doit apprendre les leçons par la 4e vague de la pandémie.
Opérateur, prochaine question.
The next question is from Stephanie Levitz from the Toronto Star. Please go ahead.
Hi, Mr. O'Toole. Happy New Year. While we could, yes, it's true that tests can absolutely detect COVID-19. The reality, though, is that it's the unvaccinated who are at greatest risk of ending up in ICU, and it is the unvaccinated that are overwhelming, at risk of overwhelming the healthcare system. And in turn, it is the risk of overwhelming the healthcare system that is the reason that we're all locked down. So the question I have is, why should the unvaccinated be accommodated if it is their decision to get unvaccinated that is leading to part of the crisis in the healthcare system?
Well, you've raised an interesting thing there, Stephanie. You're absolutely right. The incident rate in ICUs will be far greater for non-vaccinated. That's why we have to get as many people vaccinated as possible. If Mr. Trudeau's rhetoric calling people names was effective, we wouldn't have that problem. But what we found with Omicron, if you actually look in a total way at the data, is you're also going to have some hospitalization and a lower number of ICU admission for people that are fully vaccinated. In some cases, even with the booster, as we're seeing out of Denmark and other studies that are literally being watched on a daily basis. So the more we can give all Canadians tools to keep the spread down and to keep normalcy to life is what we have to be doing. What is crazy is we haven't learned the lessons from the first wave. We're back to ordering PPE for Parliament Hill from China. We haven't delivered the rapid tests promised almost 2 years ago on his doorstep. He orders them in the middle of the 4th wave. That's unacceptable. So we need to keep strain off the healthcare system as much as possible, and giving Canadians, communities, schools those tools is part of that.
And just as my follow-up, do you think it's safe for kids in Ontario to be in school in person?
Well, I'll use an example of my nephews in the UK. They've been rapid testing to go to school for the last year and a half in UK, with tests sent to families in their school weekly. So how can we use all measures, including what the provinces are doing in terms of the air quality, on masking, on PPE, on rapid tests, to try and find ways to make this work? British Columbia last week, one of the leaders of the teachers union said they were 11 million rapid tests short to effectively, in their view, open. Why are we short? 2 years ago, he said the 2 key tools to fight this pandemic were tests and contact tracing. How did that app Justin Trudeau create turn out? He's ordering large numbers of tests now. We were one of the last countries out of the G7, G20 sort of developed comparators that actually approved and ordered rapid tests. My first question in the House of Commons, after one on reconciliation, was on rapid tests. They have been asleep at the switch, and Canadians saw that when they couldn't find them when they needed them.
Operator, last question.
The next question is from Travis Danraj from CBC News. Please go ahead.
Hi, Mr. O'Toole. Happy New Year to you. Thank you for taking our questions today. I just want to piggyback on, what some of my colleagues were asking. You say you want to take the temperature down when it comes to those that aren't vaccinated, but many simply say, listen, I'm not getting the vaccine. I've read the research. I'm informed. I see the situation in hospitals and ICUs, but this is about my fundamental choice in my body. So short of tougher measures, why are you so convinced that you can change these folks' minds so far into the pandemic? And what is wrong with tougher measures for the unvaccinated? We saw when there were vaccine mandates put in place, when people were told they can't fly because if they're not vaccinated, vaccination rates went up. So what is wrong with that?
Well, Travis, Happy New Year. I've said that we respect provincial decisions to drive that, including the use of QR codes, passports, all of those tools. But there are going to be as much as 15% of the population that is not vaccinated. We should be proud that most Canadians have had questions answered and have done that. How can we get that amount down even more? The medical experts I've spoken to is education, is dealing with anxieties. And that's what we have to do in conjunction with measures that some of the provinces are doing. But let's not kid ourselves. Mr. Trudeau has tried calling names. He announced a mandate without even getting a charter opinion on the mandate. Most of the tribunal and court decisions in the last few months on mandates followed exactly what I said, which is in some cases, you will have to try and find reasonable accommodations between keeping people safe and people not losing their job, losing their home, not being able to provide for their kids. I don't think that position is irrational when people's lives are on the line. Can we get as many of them vaccinated as possible? Let's try and do that. But with the trucker example I talked about today, Travis, we're going to see prices skyrocket for groceries, for everything, if we see tens of thousands of truckers unemployed. We've already got a shortage of about 16,000 to begin with. So how can we use smart, reasonable measures to do it safely? I would rather see that smart approach than division and pink slips.
And on lockdowns, you say that you respect the decisions of provinces to minimize the spread, the decisions that they're making. But the provinces are the ones determining whether or not lockdowns should happen. It was Premier Ford and his cabinet here who decided to put Ontario back into stage 2. So why are you blaming the Prime Minister for lockdowns, which are provincial decisions, and do the provinces hold any responsibility when it comes to these lockdowns, in your view?
In spring of 2020, Mr. Trudeau on his doorstep said he'd spoken to the provinces and the federal government was taking responsibility for testing and tracing. He actually said those measures would help keep the economy as open as possible. That's what he said at the beginning of this pandemic. He simply hasn't delivered. The programs of support the federal government put in the budget last year is the substitute. He's funding lockdowns as opposed to funding tools to actually help us keep some balance here. The priority has to be the health and well-being of Canadians and keeping pressure off our systems as much as possible. But he's also had 2 years to help develop surge protection for hospitals and ICUs. I haven't seen any action from the federal government on the key tools that would have allowed the provinces to make some other decisions. And I'm hearing from educators in BC, in Ontario, that have said directly that the lack of PPE and of rapid testing is part of the reason that there's some concern or a delay to schools. That was Mr. Trudeau's commitment almost 2 years ago. So as opposition leader in Ottawa, we're calling back the Health Committee to try and push to fill the gaps, to actually make him deliver what he said he would years ago.
What do you mean? Thank you. What do you mean he's funding lockdown?
Thank you very much.
But what do you mean he's funding lockdown, though? Can you precise your thought on that? Because I'm not sure I understand what you mean. Can you precise your thought on why he's
Thank you very
funding
much.
lockdown?